Do I have lower lid retraction or ectropion? I had lower eyelid surgery with lateral canthopexies 13 months ago. I am concerned I have either lower lid retraction or ectropion. If I have either of these issues, what are my options for correction? I would appreciate any feedback.
Thank you for your question. You submitted a question about the diagnosis or diagnoses of your lower eyelids after undergoing eyelid surgery prior, and you are asking if you have ectropion or lower eyelid retraction. Well, it's clear that you've done some research and you've learned a lot about the terminology. And just for the sake of clarity and definition, let's define ectropion is when the eyelid is everted away from the eye. In other words, the margin of the eyelid, which normally sits flush with the eye, is everted away. Eyelid retraction is when the entire margin of the eyelid is actually pulled downward. And so with the photos you submitted, I'd have to say that you have both an ectropion and eyelid retraction. So interestingly, this situation that you have is one of the most common issues that I deal with in my practice as a referral specialist. And very often, people who have lower eyelid surgery will have some degree of retraction, and sometimes they'll have more than that, to the point where they have eye irritation, they don't like it's clearly the appearance of the eyes are not right. So let's understand what the options are, and it's based on some simple, straightforward anatomic principles. So we'll start with addressing the ectropion. If there is ectropion after lower eyelid surgery, it's typically the result of there being a relative shortage of skin that is adequate in order to allow the eyelid to be turned towards the eye. So this can be the result of the skin quality, it could be the result of scarring and the healing process, but in the end, if the eyelid is everted, you need skin. Now sometimes we're able to recruit skin from the cheek area, other times we have to do some kind of skin grafting procedure. And people always get very concerned about the words skin graft. And so, but the anatomy ultimately has to be addressed properly in order to get the benefit of getting the eyelid to be positioned in the right way. So that's one part of the equation. The second part has to do with the retraction. The eyelid retraction is actually a complex situation where, because of the healing process after eyelid surgery, there is typically some form of scarring that has occurred which caused a pulling down of the lower eyelid. And so routinely in my practice, if it's a mild degree of retraction, I can actually just release the scar tissue and manage the healing process thereafter to prevent the eyelid from pulling down. More commonly, I have to do some kind of grafting procedure. In my practice, I use a material called Enduragen, which is the dermis, or the backbone of skin, that's derived from pig, and is used in a lot of different reconstructive procedures and is safe for human use. What I'll do is I'll place that on the underside of the eyelid from the inside so that there's a vertical support. It's almost like a bridge where you have a pillar supporting the eyelid. Last but not least, when there is an issue with support of the lower eyelid, I will typically do something called a lateral tarsal strip, or where the end of the eyelid, which is attached to a structure called the lateral canthal tendon, has to be attached to the inside of the bone where it originates. Now sometimes that area is just not strong enough to hold, and the stitch would come apart. So I do another procedure called a drill hole canthopexy, which also sounds unsettling, but it basically means drilling very tiny holes in the bone where that tendon needs to be attached so that there's a strong, stable point of fixation for the support of the eyelid. Now, I'm not saying you need all of these things, but in my practice, these are the typical procedures I perform to help people improve their appearance after having had cosmetic eyelid surgery done elsewhere. Now, the things that I can't do from your photos is a physical examination. So when I do an evaluation for someone with ectropion, lower eyelid retraction, I typically move the eyelid upward and I try to see the elasticity. I look at how much give there is with the skin, and there's basically a feel that is part of the decision-making process on what kind of procedure someone in your position would need. So probably the best thing first to do is to address this with the original doctor who did the surgery. You know, when you perform surgery on a patient, you know that patient's anatomy and you know a lot that somebody fresh to the scene may not be as familiar, just because, you know, when you're the doctor who's done the surgery, you kind of observe the healing process and you kind of know what may be something that you can correct that you are already familiar with. So that's usually the ideal. But if you feel that, or your doctor feels that this is outside of what they're comfortable doing, then finding a referral specialist would be your next step. Again, to summarize the answer to your question, from the photos you submitted, you do have ectropion, you do have lower eyelid retraction, and there should be a plan of action to address these concerns. And I hope that the information I provided for you was helpful. So I wish you the best of luck, and thank you for your question.